Howdy, y'all. This is Dr. Adam Bonder with Clinova Solutions, where we're amplifying the future of urological care for patients who've been overlooked for far too long. Too many people are still suffering in silence, not realizing there are better options, and that access to innovative care shouldn't be a privilege. It should be the standard. Today, I'm excited to introduce Martin Dawson, a true advocate for advancing urological pharmaceuticals and delivery systems across Europe. His work is pushing boundaries, and more importantly, changing lives. Martin, thank you for being here.
Thanks, Adam. Thanks for inviting me.
Absolutely. Let's get started.
I got into this back in 2018-ish, where I set up my own business, Medi-Sell, and I took on a hyaluronic acid product for recurrent UTIs and cystitis. I've come from a pharmaceutical background, so I used to sell one of the competitors. And when I used to go in and see the nurses and the doctors in the hospitals, particularly the nurses, because they dealt more with the patients on a day-to-day basis, they found it very fiddly. You had to take it out of a vial and put it into a syringe. So I found you could find something that had a better delivery method. And I found this product. I actually import it from Italy. So it comes in a bag and it's all ready-made. It's super easy, really, really user-friendly. And not only that, but the hyaluronic acid within the bag, within the product, is of a very high molecular weight, and it's exactly what I was looking for, because one of the unique selling points to the other product was it has a higher molecular weight versus the competitors over here in the UK. So it ticked so many boxes for me, and I've effectively been doing that since 2018. I'm in the process of trying to upscale that massively. I've had a couple of delays in between 2018 and now that hasn't allowed me to progress the company as much as I would have liked, but in the last 3 or 4 months I've managed to scale that up. So we're just on a journey now, so it's good timing that we're talking about this, because I feel as though it's like the second phase of Medi-Sell, if that makes sense. It's a big journey, because we're trying to go after those patients that just keep getting given antibiotics over and over again. This could be something that resonates with you guys over in the States, but over in the UK, patients with recurrent and chronic UTIs just keep getting passed around in circles in the NHS space. So they'll keep going back to their GP and they may be lucky to get a referral, but it's antibiotics and then the next dose of antibiotics, which is great and they have a place. However, you well know they're a systemic solution, they're not a localized solution. So unless you're replenishing that gag there and replenishing that damaged bladder lining, it's always going to come back. The bacteria will stick in those little gaps, and they're pesky little mites, and they don't go away. So unfortunately those UTIs will forever keep coming back no matter how many antibiotics you throw at it. Some patients are lucky and it works for them. They have 1, maybe 2 doses and that's it. They never have a UTI again. But there are a lot of patients where it's just that cycle. And so we're trying to beat that cycle effectively. Hyaluronic acid for bladder installations isn't particularly well known. It's known massively for joint injections and for creams that you put on your face, because the molecule is fantastic for that. It keeps hold of that moisture. That's what hyaluronic acid does. But for bladder installations, it's a niche of doctors and nurses that know about it. So the idea is to first and foremost educate people about hyaluronic acid being used for a bladder installation for recurrent and chronic UTI and cystitis, and then hopefully get the product used more.
Well, that's an incredible work that you're doing. And one of the things that I really want to emphasize is exactly what you said, is these patients are just passed around. They get and then go see this specialist. What you're trying to do is you're actually trying to get those patients this medication that's not widely well known, that could help them to prevent that cycle of going through all these different specialists. And that's what I'm super excited about, is I think that the opportunity to help patients in a way that hasn't been done before is something that's really changing medicine and helping people who are truly suffering. I think that's the hardest part. Is you've heard that story, that's probably part of what inspired you to start Medi-Sell, was that they continue to go around in this circle and no one's breaking it. And so to help relieve them and get out of that cycle, pairing the gag layer, I think, is super important. I think it's an avenue that we haven't fully addressed and is not widely known, but is actually showing up in the literature to being very important. across Europe?
There is the problem. Unfortunately, you're to cost, and it comes down to resource. And unfortunately, the NHS is short on both of those. So the cost argument is, antibiotics are pennies, right, versus pounds. Not thousands of pounds by any stretch of the imagination, but versus antibiotics, yes, they are a lot more expensive. But you've got to then weigh that up from a cost angle of sending a patient into hospital to get these types of products is costly. And when they get a UTI, that's costly. And if it keeps coming back, obviously that cost is just doubling and tripling and quadrupling all the time. So the cost argument for me goes out the window. And then the resource bit is also they don't need to be in hospital, but they haven't got an alternative right now unless you go privately and pay for it yourself. So from an NHS perspective, from a patient's perspective, these treatments are getting fewer and fewer because they've got much more bigger fish to fry, let's be honest. It's not a diabetes, it's not a cancer, it's not a big issue in that sense. It's not particularly sexy, so it just fades away under the radar. And the resource goes to more important things. Understandably, however, these patients are still in massive amounts of pain, as you well know. And I do remember going back to when we had COVID, we were very lucky. One of my biggest customers for the product managed to keep the product going during COVID because it was deemed an emergency product. And the patients were coming in tears. They were so grateful that they were getting it because they were in so much pain. That, to me, just emphasised that we're doing the right thing. And we've got to keep doing that. We've got to keep making these products accessible to NHS and private patients over here because the antibiotic cycle isn't going to change. It's not going to go away. I can understand it from an economics point of view. It's the easy option, isn't it? But it's not the answer.
And I also think the antibiotic perspective is only a small snapshot of the actual overall downstream effects of that. You talk, about antibiotic resistance. That's a population level effect. You also talk about, the side effects of these antibiotics. And so to offer them in a more concentrated dose or more localized area just makes sense. I think right now the adoption is lower in part because...
Yeah, I agree. And the frustrating thing for me is that you touched on it there, the clinical aspect of hyaluronic acid, it's been around for decades. And so the clinical trials for our product, for example, they're tiny. You might be lucky, you might have 20, 30 patients in the clinical trials. They're small, but you don't need a huge amount of patients in these trials to show that the thing works. It's been working for decades. And you touched on it again as well with the side effect profile. As far as the side effect profile of hyaluronic acid is concerned, it's virtually non-existent. It's one of the cleanest molecules I've come across, and I've sold quite a few in my days. So it's a natural product within the body. We create it anyway. We have it in most of our joints. You're not putting anything into your system that isn't already within the body. And the side effect profile, like I say, is absolutely fantastic. So I don't really understand why it hasn't been a little bit more successful. I understand the dynamics of the NHS and why they wouldn't want to do these bladder installations from a resource perspective and potentially a cost perspective as well. But I heard some stats the other day about admissions into A&E departments. So effectively, when they're coming in with an emergency and it's a chronic UTI, there's about a third of the patients that walk through the door. That is staggering. Yeah.
Wow.
And then you look at the cost of what the NHS charge or what it costs them for a patient to walk through the door into A&E. It's about £1,200 or something crazy as an average.
Versus one at-home or a couple at-home installations.
So for us, it's education, because what you guys do is the step before what we do is trying to encourage those patients to self-catheterize so that it's much more convenient and they don't need to go into hospital. They don't have to wait in a clinic and be treated by an expert when this isn't really an expert treatment. It's fairly simple. We can be taught how to do it ourselves. It's not particularly difficult. And add on to that, okay, I'm bigging up the product a little bit, but add on to that the fact that the product that we sell, Instellan, is so user-friendly. It's literally just clicks onto the end of the catheter, that's it, you're away. And it's all contained in one bag, it's super easy. You don't need a clinical person attending you to look after you. It can all be done and taught in your home environment.
From our experience, once you get over that hurdle of, okay, here's where I identify the urethra, I have to put this very small catheter in order to get this medication. Once they've done it once, they're like, okay, I get it. It's not, a lot of that fear dissipates. It's just something that, people aren't necessarily used to, and it seems a little foreign. But once they've gone through it one time, they're like, this is so much easier than the cycle of trying to find someone who can help get me the help that I need. And that's why I'm a huge proponent of bladder instillation therapy. I think it is the future. And I think the more that you can avoid patients going to the hospital, the better. Because you talk about hospital-acquired infections, you're talking about resource management, you're talking about wasted time at work and away from the family. I think that there's just so much impact that can be done from doing these treatments at home, especially with something such as a natural like hyaluronic acid and the benefits that it's been shown to give these patients, especially when the gold standard is just antibiotics. And I think that there's a better way. It's so great to hear that you have found a better way to do that in Europe. Which you point on, really just the big hurdle is the self-catheterization component. Once it's been explained and they've had it, experienced it, and they've had someone help them walk through it once or twice or 3 times, it just becomes something that's so simple. It's foreign, so I think that's why there's the hesitation.
Yeah.
But again, the catheters that are used for this are so small, but patients don't even typically need that for how small the catheter is and how long that the catheter is in place. And so I think that's one of the big hurdles of this treatment is making sure the education's out there, that this can be done at home. And this is something that you can do. And, I've had a lot of experience in medicine in multiple different settings. And I think one of the things that I've learned is once patients feel empowered and feel comfortable and feel as if they can walk through this themselves, they actually have better outcomes because they're more in tune to their care. They're more in tune to their body and what feels right and what doesn't and how to navigate that appropriately. One of the things I think about is if someone else is putting it in, they're not feeling what you're feeling at that time. So they don't know, okay, hey, we need to slow down. We need to adjust the angle. How long are we going to leave this in? But if it's you controlling it, if it's your own body, you set the pace, you set the tone, you set, hey, I need to take a break, rather than you're in this uncomfortable hospital setting of lying on a bed surrounded by people you don't know, about to give a medication in a way that you haven't had it before. And so there's a lot of fear associated with it. And that fear just makes everything more difficult.
Yeah, I agree. And do you know what? Just thinking about the dosing of all these products, not just our product, they're all pretty much the same. The initial bit is a bit onerous. It's every week for 4 to 6 weeks is our recommendation, but then it's every month after that. So if you've managed to crack that nut and you're doing it in your home environment, it's every month. It could literally take you 10 to 15 minutes when you know what you're doing once a month.
Yeah.
I mean, I'd rather do that than going into hospital, like you say, with people that you don't know, and it's embarrassing. And yeah, it's a no-brainer as far as I'm concerned.
And I think you touched on it best. Do it the amount of time it takes to go to your car, drive there, wait in the office in order to even get seen. And you don't know who's going to be on the other side of that, right? The nurses change, the MAs, the medical assistants change, the physicians change. So to have that ability to decide that this is okay. It's, the first Monday of the month, I'm going to take my prophylactic treatment so I don't have this continuous cycle of discomfort, pain that affects every aspect of my life. And I can now just take care of it at home. In the comfort of the setting that I chose, I think is super important to recognize that all these barriers to care, I think that's why a lot of people as well aren't seeking out this because they don't know that this is something that they don't have to have that awkward, okay, am I going to talk to a provider who's even going to understand what this means? Because a lot of people aren't treating recurrent UTIs. They aren't treating chronic UTIs. What brought you along this journey? What got you inspired to go along this urological path? Was there an event that happened in your life, a loved one that was suffering?
But I think the passion hasn't really come from a personal experience. That's not true. I guess it has come from what I mentioned previously, which is where I used to sell a competitor, and I found it frustrating that they loved the hyaluronic acid bit, so the bit that went into the patient and the patient saw the benefits. The nurses and doctors loved that bit, but they didn't love the way it was delivered. So I guess it's that where my passion came from. I thought that there must be a better way. I stumbled across this product, really. It was a bit of a fluke, to be honest with you. Found it over in Italy, got in touch with the manufacturer. Do you have a distributor in the UK? No. Brilliant, fantastic. Could I do it? The rest is history. Patients can go to where they can get these types of treatments. Not just my product, all these treatments, because they're all valuable. So I'd like to get to that situation where we have one in each county. I'd like to take it a step further. I'd like to, and I'm just going into this at the moment within the company, I'd like to produce a bladder health pack that goes along with something like our bladder installation product that has D-manos, it has cranberry tablets, it has hydration sachets. You put all that together in a pack that the patient can take home again. That doesn't exist at the moment in the UK. And maybe to take it further and take this product, it's already in some countries across Europe, but it's not in all countries across Europe, which I think is a shame. So maybe look into that in a little bit more detail in the future as well to find out why. Why is it not being used in some countries? Could we do something about that? That's a much bigger picture, I think, for the future. Right now, it's about targeting and concentrating on the UK and making these products more available for patients within the UK, either in the NHS or in the private sector, making people more aware of hyaluronic acid, what it does and how good it is for the bladder in replenishing that gag layer. And they're the key things for us right now. Hopefully the bladder health kit will come soon as well as a kind of add-on product. But it's about the hyaluronic acid bit first. I've always been passionate about that. I'll always continue to be passionate about it. I believe in it wholeheartedly that it's the right product for these recurrent and chronic UTI patients, cystitis patients that do suffer. So, yeah, I guess that's where it's come from.
Well, I love the advocacy. And since you're bringing up hyaluronic acid, could you jump in a little bit more? Tell me how it works and how it benefits these patients. And you're clearly an expert in this molecule and how it can help relieve these symptoms. So I'd love to hear a little bit more about it and educate our patients of how it can help them.
So hyaluronic acid, as I mentioned previously, it's in our body. It's all over us. We have it in all our joints, and it effectively moisturizes the joints or wherever it is present. You have it in your eyes, you've got it in your knees, your shoulder joints, and it helps lubricate effectively wherever it is. Within the bladder, hyaluronic acid is incredibly effective, because as I mentioned, its side effect profile is virtually non-existent. It's a really clean molecule. But what it does is holds onto the water molecules that it can find. And it grabs them and it binds them together. So if you then think about the bladder, it's basically a balloon, right? A bag. And unfortunately, over time or after surgery or through inflammation and infection, that bladder layer, the lining of the inside of the bladder, can get damaged. And that's when bacteria that enter the bladder through urine, etc., can get into those little gaps. That's where the pain comes from, because it can be excruciatingly painful. But the worst bit is what we also mentioned previously, was that it then gets stuck in there and the antibiotics can't get to it. What the hyaluronic acid does is then effectively, because they're big molecules and they're grabbing hold of these bigger water molecules, it's creating this gag layer, it's replenishing that gag layer that has been lost or damaged. So it's effectively creating a new bladder lining so that when the toxins come in, they're not able to get into those gaps. It's got this new layer on it. Takes a little bit of time. Like I said, we recommend dosing from 4 to 6 weeks to start with, and then maintenance every month after that to allow time for that gag layer to replenish and for the hyaluronic acid to grab hold of those water molecules and for it to stick. So, yeah, it's not a quick fix solution in that sense. However, once it's there and it's maintained on a monthly basis, it should solve the problem. It's very efficacious, and like I said, side effect profile is fantastic. So from a bladder installation perspective, that's why we believe so much in hyaluronic acid. It does a great job everywhere else. Why wouldn't it do such a good job in the bladder? And it's been clinically proven to do that. So yeah, that's effectively how it works. It grabs hold of those big water molecules. It keeps hold of them just like it does in the moisturiser that you put on your face. It's holding onto those moisture molecules, and within the bladder it's creating that layer, replenishing that gag layer to prevent infections and inflammations going forward.
That's incredible. Thank you. And I think what you hit on
Forgot to
go
mention,
ahead.
it's also got a secondary side effect is that it stops the bacteria clinging to the bacteria wall. It has a anti-adherence mechanism as well as an anti-inflammatory mechanism. So it's reducing the inflammatory material that has already been damaged within the bladder as it's going in and it's lining that bladder lace. It's reducing the inflammation. They also have this anti-adherence mechanism that is effectively pushing the bacteria out and stopping it sticking to that bladder wall. So yeah, it's kind of triple action molecule really. It's bloody fantastic. I think this is the other thing is, so this particular clinic, so we've identified another area over here which is a massive concern, but B, it's a massive potential and would be a massive benefit for the patient, which is care homes. They have huge issues with UTIs. Because of that environment they're in, the residents don't always look after themselves as well as they could do, and they don't necessarily have the staff looking after them on a one basis. So it's a difficult environment to keep those UTIs at a minimum, and they're constant. And so this particular clinic is actually now trying to outreach into the local care homes and to start giving the treatments in the care homes themselves. I don't think all those patients in those care homes are going to be able to do it themselves. You know, a lot of them are quite elderly, which is understandable, but a lot of them would be able to do it themselves as well. Once taught, they'd be perfectly capable of doing it themselves. Or they've got an in-house nurse that can be trained, and therefore they don't have to keep going back and visiting. So, yeah, massive opportunity, huge potential. And again, that's something that should really be rolled out in every care home across the UK, but we'll see. Watch this space.
Yeah. Well, I think too, UTIs are one of the leading causes of sepsis, which is one of the top causes of mortality in that age group. So to be able to prevent that and to be able to be proactive against it in a way that's localized, I mean, how is that not the future?
Yeah, and I think you touched on it. It's that the idea of it being complicated and messy and fussy and bigger than it actually is. There's no reason why a fit and healthy, active, mobile, recurrent UTI patient can't self-catheterize at home and give these types of installations at home in the comfort of their own home, and it can take them, once they know what they're doing, 10 to 15 minutes, hold it in your bladder for half an hour, you go to the toilet and wee it out, done, once a month. I don't think that's, and I'm sure a lot of patients would agree, that that's a massive chore to not have all the problems and issues that go with recurrent and chronic UTIs and cystitis. So, yeah.
I couldn't agree more, Martin. Thank you. Thank you for raising awareness for this. Thank you for pushing this treatment option forward. Thank you for helping patients. Which is why we do everything that we do, is for the patient. And so thank you for helping the patient, help decrease their suffering, help break the cycle of specialists, antibiotics, and treatments that just don't work. And so having you on the forefront and having you inform patients that this is an option that could help prevent reinfection is something I'm super proud to say I know you and that you're pushing this forward, Martin. I think that it is the future of medicine, and you championing it is only going to help more people.
Yeah, thank you. I appreciate it. Look, one thing I should make very clear, I'm not a clinical expert here. This is just my opinion. I love the product because I think it could, and I know it does because I've seen it benefit patients. So I know that the product works. I know that hyaluronic acid works, and I know that it's not, the education bit's not there over here. So I don't want people to think that I'm a clinical expert. I'm not by any stretch of the imagination. This is just my opinion. But the clinical evidence is also there for hyaluronic acid. It's been there for decades. There's no disputing that, and there's no disputing that it works. All I'm doing is just trying to create some awareness around the available treatments that are there instead of sometimes the antibiotic cycle. So yeah, I just thought I'd make that point.
Well, thank you, Martin. This has been absolutely incredible. I'm super excited to see what you're pushing forward and how you're helping patients at scale. And I think, we'll be touching base relatively shortly and finding out. Yeah. Well, I think next time we talk, we're going to find out, okay, hey, look, we've got this new large cohort of patients that are now doing better or not in this similar cycle.
Yeah,
I think, and I know that this is going to help patients. I know that there are going to be patients that improve with this treatment. And so to know that these options exist is it's going to do a world of difference.